Leisha. Thanks so much for letting me ask you some questions today. I know that lots of people that interact with my content would love to hear more about how hormones can really affect mom life. So just tell me a little bit about like who you are and what you do.
Yeah. Okay. So obviously, my name is Leisha. I am an RN and a functional diagnostic nutrition practitioner, and I specifically specialize now in women's health and hormones. So I work really specifically with moms, usually who have had a couple of kiddos, and could be in kind of the postpartum phase, like we're going to be talking about today, like really soon after childbirth, or could be a year or 10 down the road. Because I think that these things really do apply at different levels all the way through. And so I really work with women to balance their hormones, but not just looking at hormones specifically. I really like to get to the root cause because I think really like that's so overlooked so much for women and it's a really big disservice. So that's a little bit about me.
Yeah, I love that. I'm always talking about different ways that kind of after we have babies, the focus goes away from mom. So I love that you are talking about how we can help mom, her health and be balanced. So that is awesome. Um, Tell me a little bit about what is normal to feel postpartum versus what might be abnormal as far as hormones go.
So when we're talking about postpartum, I think what comes up right away is like immediately after the baby is born and kind of like that first 6 weeks. But I definitely think that like the postpartum period is really honestly like at least the first 12 weeks. I don't know if you agree with me there, but like
Absolutely.
I think 6 weeks is like so short to just assume. I think the common assumption is like you're fine, like back to normal, right? And even a lot of times like women have babies in the hospital and get out of the hospital and like they just are kind of told like go do whatever, like don't like use tampons or have sex for 6 weeks, but other than that like do whatever you want. And man, like there's a lot that happens to your body when you have a baby. I've had 2 kids and like it takes a minute to get kind of like back on your feet, even not like back to normal, but just like even back on your feet. So when I'm talking about postpartum, like I'm definitely talking about at least a 12-week period. Um, but I think that some things to kind of like be looking for. I think it's a common misconception that like postpartum just has to be really hard and that you have to be exhausted all the time and that you have to be like super like up and down with your mood. Now, I think that there is some aspect of that that's normal. And so we'll go into that. And obviously, I think that it's really, really important to surround yourself with people who will watch out for you because in that period, I think all of us who are moms, like you kind of like go through that period and eventually, whether that's like 8 weeks or 12 weeks or 1 year later, you come out of it a little bit and you're kind of like your head's above the water all of a sudden and you're like, wow, that was rough. But in the middle of it, you don't even notice sometimes, or you just kind of think it's normal. So I think that really like having that support is super key in postpartum and having like your husband or your best friend or your mom or like whoever your support system is or all of them be like watching out for you in case you are really developing something that's more severe as far as like postpartum anxiety or postpartum depression because that happens. And I believe that one part of it is that it happens when moms are really depleted. So what I would consider kind of more of normal, and it's going to depend on the woman, is yes, you're going to be tired if your baby's not sleeping. Yes, you're going to have some ups and downs in your mood as hormones change, but that doesn't mean you should be like crying every single day or feeling really, really sad all the time, or like it's not normal to just be like super worried about your baby all the time and like really anxious. I think that like that's another kind of misconception, right? That it's just kind of normal to be like anxious about your kids as a mom and like fearful. When yes, absolutely, like you love them and you care about them and you want to watch out for them and make sure they don't get hurt. But feeling like these feelings of like, oh my gosh, I wonder if my baby's going to die, or like, I think they're going to stop breathing, or like, why is their toe that color, like all the time, where even your husband or your friend is like, they're okay, just kind of like looking out for those type of emotional reactions from yourself. Like, I really would not consider that those are normal, or feeling just like exhausted all the time. Where you like can barely drag yourself out of bed for weeks and weeks and weeks, and I'm not talking about the first 4 weeks or 6 weeks, but like after that, if you can't get yourself out of bed and your hair is falling out and like you're just feeling super depleted, that all of those things are just a sign that you need some extra support and you need some nourishment and some extra attention on like building your body back up. So I know that was a super long answer.
No, that's really helpful though. I think especially the first time around, it's just so
Yeah.
hard to know. I've worked with a lot of clients that say, with my second, I got help because I knew the difference from 1 to 2. So it's
Mhm.
just like that first time around, though, you just have no idea what to expect. So
Right.
that's really helpful.
Right. And I think different when women handle it differently based on their personalities, based on the way their bodies are working, based on their support system. Like I think all the pieces. So I would say another thing that's just like really important is not comparing yourself to other moms and feeling like you're not doing it as well, because everyone's different and that's okay. And it's okay to ask for help. Like I think that's the biggest thing postpartum, like that I would tell anyone who's having a baby now, especially a first baby, is like ask for help with everything, like literally everything for a while. And it's okay. Like this is the time that you can.
Yeah. And I think a lot of times people want to help, they just aren't sure what to do. So utilize that the
Right.
people that are offering for sure. Well, I'm just gonna just ask you a bunch of questions, and then you can maybe ask me a bunch of questions. I think since we're on the kick of hormones, and we're talking about taking care of ourselves, when it comes to self care and you have a newborn, that's really challenging. So, what do you suggest or recommend when you talk with people?
So I think one of the biggest things is like being realistic in your expectations. And to me, being realistic in your expectations doesn't mean having no expectation for self care. It just means like, when you have a brand new baby, like I think the biggest thing is just actually like even before you have the baby, or maybe while you're sitting there nursing sometime or feeding them a bottle, whatever you're doing, just like ask yourself, like, what feels really important to me? Like, what do I feel like I need? And then prioritizing that. So for some women, it's like taking a shower every morning and putting on makeup. For some women, it's literally wearing pajamas every day because they need to feel like they can rest. For some women, it's like getting sunshine every day. But for everyone, something that I really recommend as self care, and I think normally like it wouldn't be thought of that way, is just like feeding yourself very consistently and well. Because when you are not eating, especially if you're nursing, but really no matter what, when you have had a baby, your body needs to replenish. And so if you're getting really busy or you're too tired to get food for yourself or whatever that looks like feeding yourself really consistently is the best way you can take care of yourself. And then also like resting. And I know it's so cliche to say like nap when the baby naps. And I know like depending on how many kids you have, sometimes it works and sometimes it doesn't. But I think just looking for those opportunities to like say yes to what you truly need. And again, like asking for help. I think those are the biggest like self-care techniques that really make a difference postpartum. And like you said, from going from my first baby to my second baby, I had some different expectations and knew like, okay, it was rough for me in these ways. And so this is what I'm like hoping to change. And even just like getting out in the backyard every day for a little bit was really a big way that I was caring for myself and for my baby. And like, even if it was 5 minutes or 10 minutes and it felt like the hardest thing to get out there, it was always worth it. So I think just looking at the little things as truly self care would is really important postpartum.
Yeah. I have been seeing something going around on Facebook that's like, taking a shower isn't, self care. We deserve more and stuff like that. And I do agree that, like, for the lifespan, like for your lifespan, yeah, a shower is a necessity. But as a new mom or just a busy mom in general, sometimes that is self care. It kind of depends what stage of life you're in. And so I love that you said, what is important to you? Because, sometimes a shower where I actually get to like shave and wash my hair at the same time, like that's enough. That can like help me feel filled up a little bit. So I think it is unique to each person. So that's a great take on that.
Yeah, absolutely. I think just managing your expectations and then also like not letting someone else's, like self care suggestion make you feel like you have to do that. So for some moms, like people would be like, oh, you need to get out and like, go see your friends or whatever. For some moms, that's going to be like exactly what they need. And for some, it's going to be stressful. So I think just being honest with things like that.
Yeah, that's great. That's great. And then I just have one more question that I think I kind of see a little overlap with this and in what I do with physical therapy. And our hormones, if we breastfeed, are different for a while. So on my realm, it's like talking about vaginal dryness and things like that. But what about like from your end? Can we do anything to balance out our hormones even if we are breastfeeding, or are we just kind of like, should we wait until after? What do you recommend?
I think, again, I always say this, it's going to depend on the woman and the situation, but definitely like those first like 6 to 12 weeks postpartum, like you're not going to be doing like some sort of like hormone therapy protocol by any means, because everything has to start to self-regulate. But I think that it is really important to make sure that you are supporting your body well, because hormone imbalances generally come from other issues, whether that's like gut or liver imbalances, or um, from a lot of stress. Like a lot of stress can impact gut and liver imbalances. So I really think that postpartum, like the best thing you can do to nourish your hormones is to sleep and to make sure you're eating really well and consistently, and then like managing stress in whatever ways you can. And so if you feel like your hormones are way off, your mood is way off, you're having crazy periods all of a sudden or something like that, like if you don't get your period back for a long time, that's pretty normal. Especially like the first year is super normal. After that, it might be good to kind of like check in with someone and make sure everything else looks good for you. But when you're breastfeeding, just nourishing your body really well and managing stress and sleeping as well as you can is going to be really key in balancing your hormones. And then if you really feel like something else is off, you can absolutely ask for help in that period and see if it's appropriate at that time. But really, like the biggest things are going to be supporting your body well.
I like that because it's not really complicated. When you are breastfeeding and doing all the things, it's like I don't have time for one more thing. But if it's as simple as like food and sleep, I think that's something that with a little bit of effort we can all make some time for. So it's not like a crazy routine or a bunch of supplements or anything like that. It's just simple.
Right, exactly. I'm a huge advocate for just having really good quality snacks that you either make or buy in the house, and like having basket by where you're nursing, because every time that baby eats, you probably need to be eating too, at least something. So I really think that that can be key. And I know it's hard to like be consistent with that, but just kind of making that a goal is a really good thing. Definitely have some questions for you.
Okay, yeah, great.
For who's not familiar, Dr. Nicole is a pelvic floor physical therapist, which I think if you're a mom, I'm sure you're like, oh shoot, I probably need that. So I have some questions for you specifically on postpartum, and then I'm sure we can definitely go into some other topics later.
Yeah.
But like physically, we talked about hormones, but like physically, pelvic floor, what's kind of like normal postpartum and what's definitely not normal?
Yeah, so agreeing with most of the things you said, it kind of depends which stage that you're in. But I definitely consider postpartum at least 12 weeks, probably more. But as far as your body goes, there's kind of like the first 6 weeks. And sometimes it's deceiving that after 6 weeks, everything is going to be better because for some reason, like they say, okay, you can have sex again, like you're going to see your provider and all these things. And so I think we assume that, yeah, things are going to be good. But what I would say is in those first 6 weeks, you're going to experience a lot of discomfort. You're in a lot of healing phase, especially if you've had perineal tearing, you've had a C-section, anything that required stitches or tearing, like tissue and muscle and all that is healing. But even if you haven't delivered that way and everything went perfectly, you really should be resting, recovering, just like you were saying, physically. You are, yeah, you are going to experience pain and things, but you shouldn't not do anything here either. So some people say don't exercise at all till 6 weeks, but what I would say is you could be gently starting to retrain your pelvic floor and work on your core muscles, but it's not going to be like, I don't want you doing a core workout or something. It's really just focusing on simple things like breathing, and I call it belly breathing. I'm a huge fan of belly breathing because it basically reorients all the nerves and it retrains your brain where muscles are supposed to be, because for so long they were stretched out or they were moved in ways that was different. So you just start with belly breathing to kind of reorient everything to where it's supposed to be. And you might start with something like gentle, like body weight squats or things like that. But you're not going to be working out hard. You're just focusing on healing yourself at that point. So it's pretty normal to be in pain, especially if you've had any perineal trauma. But once you get past that 6 week, the pain should be going away. Incontinence should be going away. You're probably going to think about making an attempt at intercourse. And it's at this point that you're starting to look for what I would call like red flags or things that are warning signs that time isn't probably the answer. So in those first 6 weeks, you're just giving things time. But after that, if you're noticing things like I'm peeing when I laugh or sneeze, I can't make it to the bathroom, like the urge is so strong, I'm peeing on my way to the bathroom. You've tried intercourse a couple times and it feels really painful during, when you're trying for penetration or during thrusting or afterwards, it's really painful. Those would be abnormal things. If you feel a lot of heaviness or bulging in your vagina, this could be a sign of prolapse. That is not normal. These are kind of things that are like, they happen a lot. So if you're experiencing them, I don't want you to be freaked out or like, oh no, there's something wrong. It's easily remedied with physical therapy and some pretty targeted exercises and activities, but it's not something that's probably just going to go away if you wait long enough. Like the thing that makes me so sad is when women are just like, if you just give it time. And unfortunately, sometimes even providers, they don't have a lot of training in this, which is okay because that's what pelvic floor physical therapists do. But unfortunately, they're not sending women to pelvic floor. I don't know why I can't say that word today, but pelvic floor physical therapists. And so women just think if I just wait it out, like it'll just get better. And that's unfortunately not usually the case. In fact, things like incontinence usually get worse, especially if you're going to have more babies and stuff. So,
Okay, so after 6 weeks, we want to wait it out. But after that, if we're like, this isn't getting better, then time is not necessarily what's needed.
Yeah. So if you're still having to sit on a donut or a really soft chair because you're so sore, that's definitely not normal. And like I said, leaking and incontinence, if it's going to get better on its own, it's probably done that by 6 weeks. And as you're working through like the 6 to 12 week period, that's a good time actually to reach out for help because hopefully you have a little time off from work or at least a little lighter schedule. So that's a great time to really focus on healing your body, because a lot of times by 12 weeks, even though you're probably not completely healed, the world expects you to kind of physically be getting back to normal again with jobs and things like that.
Right.
So yeah.
Yeah, I think it's so interesting to see like different countries have different maternity leave and different things like that. Like, so for me, I went back to work at 12 weeks with my daughter and I worked in the hospital as a nurse on my feet all day. And looking back, I'm like, like it was okay. I was 23, so that's a good time to do things like that. But I think just kind of the fact that that's the norm is, I don't know. With my son, I went back. I think I went back around the same time, but I was working less at that point. So that was good. But yeah, just kind of like thinking about that as like, maybe that's good for like a perfectly healthy 23-year-olds and it was fine, but like, was it really fine that I was working that super long shifts and like still waking up multiple times a night and then like pumping at work? Like all of that's just, it's a lot. So I think sometimes when you're doing it, you're like, oh, it's good, it's fine, and you get through it. And then sometimes you look back and you're like, man, I don't know that was the best for my body actually, or my mind. Sometimes you have, and in my case, like I had to at that point. My husband was in school, so It's amazing that our bodies heal well enough that we can do those things.
It's great that in some countries they get like a year of maternity leave, and that doesn't necessarily have to happen here, but it would be really nice if we had like a gradual workup. You think of other injuries, like, okay, if you had a back surgery or hip surgery, they might say like, okay, you're going to come back at like working partier shifts, but it feels like after having babies, it's just like, no, that would be really abnormal. It's just like, go after it. Like, oh, 12-hour shift, get it done.
I feel like that would be so good if I was like in charge of postpartum rules and regulations for businesses. Like even the first couple weeks, like doing half days as a mom, like being kind of a standard, because it's hard to leave your baby at that point. And sometimes it's really hard if you're like pumping and things like that. So transition, I'm for that. If anyone's in charge of that stuff is listening. So just to like kind of circle back and make sure we've covered this well, what are a couple of signs, just like if they're more than 6 weeks postpartum, like that it would be like, oh, I definitely need pelvic floor therapy. So I think you mentioned like peeing on the way to the bathroom, like leaking when you laugh, and then like pain in your pelvic area or like painful intercourse. Like any of those after 6 weeks would not be considered something that will probably get better on its own.
Yeah. Yep. And then the
Okay.
other thing I would say is if you are an athlete, and I'm using this term really loosely, but like if you're planning to get back to running, or you are a fitness instructor, or you do a lot of physical activity, then excuse me, you would want to see a physical therapist too, because they actually say that for a lot of runners to really get back to normal, it takes like a year really of rehab, and you're working specific things during that period. So even, I guess there's not something that's, you're probably going to start exercising and it's going to feel okay. But if you want to get back to lifting or running or serious exercise, you probably should see a physical therapist too, just to make sure that you're not actually going to injure yourself getting back too soon. I've definitely heard some runners say, I wish I would have taken my time getting back and worked with someone who was a specialist in this area, because I ended up like with incontinence, or I ended up with an injury that I probably could have avoided. So,
Well, and I don't know. I don't know how long like relaxin stays in your body. It's a little while after postpartum, isn't it? So that's a piece of like muscle and joint injuries, and I imagine that could also relate to your pelvic floor. So,
absolutely. Yeah.
okay, so if you feel like if you're a mom listening to this and you've had a baby pretty recently and you feel like you're having some physical challenges like Nicole has talked about or something similar, like what should she do at that point?
Yeah. So, so if you're in the United States, most states now are allowing you to actually have a consult with a physical therapist without even needing to talk to your medical provider, your OB, or whoever you see for medical things. So you could reach out to physical therapists. Most people know that you can see physical therapists in person, and that's pretty traditional, but it might be surprising to learn that even before COVID, you could actually do a virtual consult with a physical therapist. And this might sound kind of weird, but there's actually a lot of things that we can do with just like a video call. I can have someone do squats. I can have them show me what movements are uncomfortable. They can explain to me when they're leaking, and we can talk about that. I make videos for clients a lot that is like an exercise program with videos attached, so that you'll know that you're doing it right, and you actually can, it's actually almost nicer than in person in some ways, because you'll have that, you can take that with you, and whenever after your next baby or whatever, you could pull that back up and look at it. But so virtual consults is also another thing. And then sometimes just general information is really helpful. So something I created recently was a postpartum program. It's basically like a birth course in reverse, or in the after. So it's kind of like if you're a first time mom and you're just like, I don't really know what to expect. I don't want to end up with hemorrhoids because I'm constipated all the time, or like, I don't know how to lift my baby carrier. Just kind of a general overview about things you might face as a new mom. So I created a course like that. I don't really know of anything else that's out there like that, but sometimes just a course to educate yourself. I mean, I think you've talked about this too, Leisha, like sometimes just knowing what's normal, what's not normal, and avoiding some of those more catastrophic injuries down the road by just being prepared. So those are different ways I recommend women reach out. I highly recommend, though, if you call a physical therapy clinic to try to see someone in person, make sure they're a pelvic floor therapist, and even more specifically, do they work with like a the obstetric population or moms that have had babies. Some people will claim that they can work with women after pregnancy, but they aren't actually like trained in an internal pelvic floor exam or have any continuing education specifically for moms. So I would definitely ask that question.
Yeah, definitely. I know for me, I would definitely want someone who understands that specifically and goes through it. And so, and yeah, I mean, even for me, I'm a couple years out from having a baby, but I would love to make sure that my pelvic floor and like my abdominal muscles and things like that are basically like safe to go forward with another pregnancy, or like maybe not safe, but like that that I'm in good shape so that it's not going to be an issue during pregnancy, like when that belly gets really big, or definitely postpartum. So I think that is an important piece too for anyone who's just like thinking about another baby. I know that there's definitely some work that I could do there.
Yeah, yeah. I mean, just like anything else, the stronger you go into something like that, the hopefully easier your recovery will be. So there's definitely benefits to that.
Yeah, awesome. Well, I feel like definitely have covered some good things today. And I know that we'll probably plan to do some more talking in the future. And I'm so thankful for your wisdom. And I think that it's just so important to be talking about these things because it's so common. I mean, like, obviously, like people have babies all the time, right? But I think it's just so common for us to just assume, like, oh, I'm superwoman. I can get through this without any help. And you know what? Like, maybe you can, but is that really like what you honestly want? Or like, do you want to do this well and feel good? And so, Nicole and I are both definitely here for that, just helping. I think we both have this vision of just really helping restore health and function in motherhood. And I know personally for me, my big why for that is because I want moms to be able to feel good so they can be the mom they want to be and the wife they want to be and the person, like the woman that they want to be. It's not all about motherhood either, but just being able to feel good and energetic so that you can be present. And then, of course, like with Nicole's stuff, like you don't want to be peeing yourself like for 30 years. It's just not worth it.
Yeah, yeah, because it gets
And
worse, not better.
yeah, exactly. So definitely think that's super important.
Yeah. So, Leisha, if people want to learn more about what you do, and depending on what platform they're watching this on, like how do they find you? How can they reach out to you, and what do you offer?
Yeah. So the easiest way to find me is on Instagram, if you're on Instagram, and that's at abundant.life.wellness, or you can search my name, Leisha Drews, should pop up there too. And then I think we can probably link to my website as well, but I definitely have the links for all of that in my Instagram. So go follow me there. I give a lot of free information about hormone balance there. And then I also work with women one on one, and I have an upcoming group program for specifically moms who want to balance their hormones, increase their energy, and really honestly feel just so good that they can be more present with their families. And so it's going to be a 12-week live program where we go through every single week and talk about one of the pieces that it really takes to be able to nourish your hormones and balance them, and just really nourish and love your body well in a way that works for moms, because moms are different, right? Like we have a lot of stuff going on and we need some extra support, honestly, because we're trying to hold up the world on our own a lot of the times. So I've created this specifically for moms. It can also be for other women who are not moms, because really like the pieces apply when we are starting to build up nutrition and making sure that exercise works well for you. I also talk a lot about cycle syncing because I find that that's really, really key in productivity and in mood and in nutrition. Like there's just so many pieces there that we can go through. And really the ultimate goal is to come out on the other side feeling better, more energy, more present, better periods, better cycles. And then just really feeling confident in your body again and starting to understand how your body works so that you can move forward in a way that feels really good to you and really healthy to you without like lots of just extra restrictions or lots of time spent on Google wondering about like something related to your hormones or what you should be eating. Like just kind of like coming out of this with some of those answers and feeling really confident and having all of the support that you need to get to that point. So that's the group program. I also do the same thing with clients one on one. And all of that information is on my Instagram profile. And so if you watch this and want to reach out, definitely feel free to send me a message. I love to chat with any ladies who are just interested in health and hormones and mom life and all that stuff. So
Awesome. I think we need to do a whole nother video about cycle syncing because I just think that's so interesting. So
yes, oh, I love cycle syncing. And so, yeah, so if anyone's watching this on my side, how can they find you, Nicole?
yeah, so I also am on Instagram. Mine is at mamas and misses underscore PT. I post a lot of stuff there, but if you are really want to learn about, like, I have incontinence, I have prolapse, and you have a certain topic, if you go to my YouTube channel, which is also Mamas and Misses, I have tons of videos and they're kind of organized out into different things like incontinence, prolapse, postpartum, pregnancy, all things like that. So that's where I post like the meat of my informational stuff. So if you want to learn more, that is definitely a great place to find me. So
Okay, awesome. I'm excited to go check that out myself. Definitely have seen lots of your Instagram, love what you're putting out there, but I haven't watched any of your YouTube videos yet. So I'm excited to do that.
cool. Yeah. Hopefully I'm sure you will learn something. There's lots of stuff.
Oh, yeah. Sure.
Well, thanks so much. It's been great chatting with you. And I'm sure our followers are learning something new today. So
Yeah. Awesome. Thank you for chatting with me. It's been fun.
yeah. Bye.